This is going to be my oral medication skills demonstration for nursing skills 1. First, what you're going to do is you're going to check your MAR against your physician's orders. And my assigned patient was Jack Smith, date of birth 5/12/31. And upon looking at the physician's orders and the MAR that was given for this patient, there were several discrepancies between the MAR and the patient's and the physician's orders. The first one was the Percentine. On the physician's orders it said 75 mg 3 times a day, and on the MAR it said Percentine 75 by mouth 4 times a day, so I did change on the MAR that needs to be 3 times a day. The next problem was on the physician's orders it said Prilosec 20 milligrams 4 times a day, and on the MAR it said daily, so I changed on the MAR the Prilosec to 4 times a day instead of daily. The Relafin on the physician's order says 150 mg daily, and on the MAR it said 1500 mg daily, so I did change on the MAR that to be 150 instead of 1500. And on the physician's orders, the multivitamin, it said 1 tab daily, and on the MAR it just said multivitamin daily. I didn't think it was really specific enough on the MAR, so I did put in there to do 1 tab of the multivitamin daily, because you could interpret that to be different if you don't know what amount to give. You should know that, so I did add that on the MAR. Now that my MAR is correct, I'm just going to review it again because I'm doing 9 a.m. meds for Jack Smith. So for him, I'm going to be doing the Percentine, the Prednisone, Prilosec, Keflex, Relafin, Colace, the multivitamin, and the patient is going to report a pain level of 8, so I'll give him a pain medication, PRN also. So I also want to check that at the nurse's station, I want to check that I have the 5 rights of the patient done. I want to check that I have the right patient, which I have Jack Smith. I want to make sure that I have the right medications against the physician's orders, which I already did. The right route, which all of them are by mouth. The right time, which it's 9 o'clock and it's 9 a.m. And I also want to check that I have the drug route patient route time. So I'm good. So that was my first check. I'm going to grab my medications and go into the patient's room at this point. Okay. So this is Jack Smith. Are you waiting?
Yes.
Upon entering the patient's room, I would want to do my second patient check. I would check that his his hospital band would say his name and MRN. I would check it against my MAR, which his name is Jack Smith, his MRN is correct. So I have the right patient. I want to make sure that I have the right medications with me, which I do. That I'm going to be giving them the right route according to the MAR, and that I'm giving them at the right time, which is 9 o'clock, so I have the right time and the right amounts of each medication. Now I'm going to explain the medications that I'm going to be giving to the patient. Jack, I'm your nurse. My name is Kayla. I'm going to be giving your 9 o'clock medications. You're going to be getting your Percentine, which is for stopping clotting happening in your blood. You're also going to be getting Prednisone, which stops inflammation. Prilosec, which is for heartburn. Keflex, which is an antibiotic to stop infection. Relafin, which also reduces inflammation. Colace, which helps soften your stool if you're being a little constipated. Your multivitamin, which just gives you all the nutrients that you need during the day. And I also wanted to ask you, are you experiencing any pain today?
No. Yes, I am 8
Okay.
on the scale.
On a scale of 1 to 10.
8.
Okay. Being that you're having a significant amount of pain, I would tell the patient that we could do Percocet versus Tylenol, because Percocet's going to help with the pain a little bit quicker and be a little bit more helpful than just plain old Tylenol would be. So I'll give you a Percocet for the pain also today.
Thank you.
At this point, I would do my third check to make sure that I have all the correct medications, the right amounts, the right patient, during the right time. With the Percentine, you want to give that with a full glass of water. With the prednisone, you want to give that with food, so we want to make sure that the patient eats at the same time. Prilosec, you want to make sure you give that with food and water. The Keflex, you want to make sure that you dissolve that into liquid so they get all of it, and then afterwards you would want to put a little bit more water in the cup just to make sure that they get all of the medication. There is a little bit of medicine problem that I did notice, because with the Relafin, you don't want to take that with another with a steroid. So I think I would hold the Relafin until I spoke to a physician about what they want to do, because it is in conflict with the prednisone. And also the Percentine does conflict with a couple other medications that they're giving. The prednisone and the Keflex, you don't want to take that, the prednisone and the Keflex, with an anticoagulant. I would hold that Percentine just until I could speak to a physician about what to do about that, whether giving it at a different time is better. So I would hold the Percentine and the prednisone until I could confirm with a physician that it's okay to give it to him. And I would also document that. So at this point, I would give the patient the Prilosec, the Keflex, the Relafin, the Colace, the multivitamin, and the Percocet, which all can be taken, which can all be taken together and not have any side effects. Thank you. The Keflex I would dissolve into a glass of water. So there's that. And this is going to be a full 8-ounce glass of water that you're going to want to take, which also
Chewable.
not all of them are chewable.
This is Smarties.
And then I would get some more water in the bottom of it. Make sure that they get all the medicine. So at this point, I would document that I gave the patient Prilosec, Keflex, Relafin, the Colace, the multivitamin, and the Percocet. I would document that I held the Percentine and the prednisone until I could confirm with the physician that it's okay to take them with the other medications that were given. And I would document what the physician said after I spoke to them and give medicine accordingly.